So again, this is being recorded so that you can listen to it later, or others who aren't here can do it. So we're really delighted to have with us Matt and his colleagues to give us an overview of engaging stakeholders in health research. I'll give it a very informal introduction in the sense that I know Matt from a number of committees, especially the National Academies of Medicine Health Science Policy Board, and have been very impressed with the work that he's done. And so wanted to invite him here so that we could listen to the kinds of things that his center at the University of Colorado has been working on, because I think it's very applicable to the kind of work that we do. So without further ado, I'm going to turn it over to you, Matt. I'm also going to say that I have to leave for about 20 minutes during this webinar, but I will be back to help with the questions, et cetera, as we go. Thank you.
Great. Well, thank you so much for inviting us to be here. I'm joined by Dr. Bethany Kwan, and I'm hopeful that Dr. Matt DeCamp will be joining us as well. I can hear him in the other room, so I know he's around. And he may be stuck on a different call for a couple minutes, but he'll come in third anyways, so we should be good in terms of timing. My background is in infectious diseases, public health, and in bioethics. And for a number of years, I ran the Institute for Ethics at the American Medical Association, and then was involved in patient and physician engagement there around improving health outcomes, specifically working with organizations like the YMCA and other sort of patient-facing, but I'll say they don't use the word patient usually, client-facing, in ways, trying to figure out how to get the healthcare system to interact with components of the world that don't see themselves as part of the healthcare system, but are super important in terms of people's health and well-being. So I have a longstanding interest in this question of how can the medical system engage with folks outside of the medical system to improve patient and population health. And that was sort of where I came to this. When I moved here to Colorado a few years ago, there was a terrific project that was just getting underway called Data Science to Patient Value. And that's what we're going to talk about a little bit today. Bethany, I don't see Matt here yet, but would you mind introducing yourself as well? Or do you want to do that when we get to the slides?
I'm happy to introduce myself, and Matt is having trouble finding the Zoom link. He emailed us. Yeah, so I'm Bethany Kwan. I am a social psychologist by training, and I do dissemination and implementation science here at the University of Colorado. And I've been working really closely with Matt on that data science to patient value group that he mentioned. And I do a lot of stakeholder and community and patient engagement and research, and I'm very excited to share some of our experiences and tools that we've developed with you all.
So I will share slides, I guess, unless Bethany, would you prefer to share the slides so that you can just seamlessly go from me to you, or?
Sure, I am happy to do that.
Okay, let's do that, because I actually, every time I share slides, it takes over my whole screen and I can't see the people anymore. So it's probably better if you share slides. I assume we're all able to share slides.
Yes, can you see? You should be able to see mine now.
There we go. So, so we're going to start out with just a few slides describing the work that we've been doing through this Data Science to Patient Value program, some of which I think you may find helpful in developing other projects. That's certainly what our intent was when we were building this, is that folks outside of our institution would be able to use specifically the selector tool that we've developed. So let me go to the first slide here, which is, I'm in charge of just doing some basic background. And so I will apologize in advance. There are undoubtedly people listening to me right now who know a lot or all of what I'm about to say, because this is sort of the background on why stakeholder engaged research is of value and some of the core vocabulary that we use when talking about stakeholder engaged research. So if I can go to the first slide or next slide. We don't have any commercial conflicts to disclose. All of us have had longstanding interests in deliberative engagement, in decision-making, what some people call democratic decision-making. We did receive funding for this work, but it's internal funding from the University of Colorado School of Medicine. And I think there's a build on this slide, which is gonna just show that we are aware that democracy is an outstanding way of making decisions about how to move forward, often in very contentious areas, but it is not without its own challenges. Next slide, please. So what we're going to do today is talk a little about key terms and concepts, and then some of the methods and tools that are used in engaging stakeholder groups of various sorts in the research enterprise. And then we're going to spend a few minutes specifically talking about how to evaluate the quality of stakeholder engaged research, the quality of stakeholder engagement in research, maybe to be more precise. Next slide, please. So just some quick definitions, because these are not necessarily standardized across everyone who talks about stakeholder engaged research. We consider a stakeholder to be anyone who is responsible in some way or is directly affected by the research that is happening. And so that could be patients, but it could also be caregivers. It could also be payers. It could also be clinicians. So these are all stakeholders, and traditionally some of them have had greater or lesser roles in the research enterprise. But we don't consider stakeholders to only be patients. And I just want to make that clear, because I think sometimes when people talk about stakeholder engaged research, they're really thinking patient engagement in the research enterprise. And that's really critical, very important, but a narrow view compared to what we were looking at, which is, you know, the engagement of professional societies, the engagement of clinicians on the front lines, the engagement of, you know, nursing staff, et cetera. Second, the definition of engagement is something that we could spend quite a lot of time on, and I'm going to go over this pretty quickly. But we considered, for the purposes of the work that we're about to describe, that engagement is bidirectional and longitudinal. Again, not everyone believes that engagement necessarily is both bidirectional and longitudinal. But for us, this was important because we were looking at a variety of different methods. And there are definitely things that some people consider to be engagement that are really just unidirectional communication strategies. And we were not thinking about those when we were doing this work. We were thinking of strategies that bring people together and allow for bidirectional communication. And secondarily, there are methods of engagement, like, you know, a single focus group. That would not actually comprise engagement under our definition, because a single focus group is not longitudinal. You may get a lot out of that interaction. It may influence your work moving forward, but we didn't consider that to be stakeholder engaged research. That is information collection, but it's not engagement. Okay, so that, again, these are definitions. Different people may have other definitions, but I want to just start out being clear. When we're talking about methods for stakeholder engaged research, we're talking about methods that are bidirectional and longitudinal in nature. Next slide, please. I just want to give you as background some of the ways in which people have thought about stakeholder engaged research. And of course, one of the most important and influential has been the Patient-Centered Outcomes Research Institute's rubric on engagement, where they define research by phase. And they talk about engagement strategies in each phase of the research enterprise, from planning to conducting to disseminating the research results. And I won't go into detail on this because you could talk a lot about how they chose to break up research, right? So you don't really see analytic strategies in here. You don't necessarily see sort of bench to bedside strategies in here. So there are phases of the research enterprise that were collapsed or simplified for this PCORI rubric, but it has been an incredibly influential rubric. And many people, when you talk about stakeholder engagement, they immediately think about, are you engaging at the stage of planning? Are you engaging at the stage of conducting the study? Are you engaging at the stage of dissemination, or one or all of those three phases of research? But in the next couple of slides, I'll give you some alternative ways to think about stakeholder engaged research and how you might organize thinking in your mind. So next slide. So another way to think about stakeholder engagement, and again, PCORI has thought about this quite a lot as well, is by who are you trying to engage? So one of the ways to think is phase of research. Another is by type of individual or group that you're trying to engage. Are you trying to engage patients? Are you trying to engage payers? Are you trying to engage health systems or policymakers or training institutions? And your strategy may differ depending on who you are trying to engage. Next, or build this slide. Oh, so these are some of the ways, if you just Google this, the stakeholder engagement will bring up a lot, mostly from the business literature. And you'll see the central one, I think, is actually probably the most common, where you'll see stakeholder engagement strategies or methods that are stratified by the level of power and the level of interest of the individual or group that you are trying to engage in your work. And it is a valuable way to think about the strategies that you intend to use. Next slide, please. So the next way to think about this is, why are you trying to engage this group or individual? Are you doing it at this phase, as PCORI described it? But there are also more specific tasks where you may be trying to engage a group because you need help with a specific task, like building trust or designing research questions for use on a survey, or efficiently disseminating or fundraising, or to improve the quality of the protocol that you're developing, etc. So there are task-oriented ways to think about engagement. Next slide, please. Oh, and this, I put this in mainly because as we thought more about this, we actually felt like this was the first thing that you ought to ask yourself before you even start considering what strategy should I use. The first question out of the box should be, why am I bothering to do stakeholder engagement to begin with? What do I hope to get out of this? And so we really elevated this question of task to the front of the list. Even though it is not usually at the front of the list, people often start with, who are you trying to engage? We instead started with, why are you trying to engage? Next slide, please. The next point I just want to make is that there are often people who talk about engagement across a continuum, and the continuum is essentially a way of thinking about the level or depth at which you hope for engagement to occur, right? So there may be engagement that is purely, at one end, just for monitoring whether this group is satisfied with the work that you are doing. And then at the other extreme, there may be engagement that is ongoing, collaborative, where you're not just checking in, you are actually using the feedback on a continuous basis to inform the development and process of the work. Next slide, please. And then the last one here is how. What is the strategy you are going to use? What methods are you going to use? And PCORI, unfortunately, I think, has given us relatively little guidance on this. What they say is that you should engage, appropriate populations, the population of interest, in ways that are appropriate and necessary for your given research context. So that's useful to know that, there may be multiple ways to do this, and that it may change, the best way may change depending on the research context. But that's not very much guidance if you start looking through the literature and realize there are 30 to 50 discrete methods that people can use for stakeholder engagement. And you're thinking, well, which of these methods is appropriate or necessary for my research context? So next slide, please. Oh, this is just the build there. And I think this is my last slide, which is to say there's a sort of traditional approach to selecting engagement methods, which is to say, what level of engagement do you want and how important is that engagement? But even this way of thinking, this goes back, this harkens back to that 4-box that I mentioned to you earlier. And I see a question popping up in the chat about the power dynamic. So that's across the right-hand side here is the power dynamic that people are often concerned with when they're thinking about what strategy should I use for engagement. Because essentially, if you are looking at someone who has high power, high influence on whatever it is that you're trying to accomplish and high interest, then you might use a different strategy. Like you might really bring that person in as a partner in the research project. But if you're looking at someone who has high influence but low interest, they're probably not going to want to be a partner on this. So you're going to need to use a different strategy for engaging them. And you go down to, people who have low interest and low influence also. Well, maybe those are the people that you really do just want to sort of monitor and make sure that they are not being actively alienated by the work that you're doing, but they're not very interested in it. So they're probably not going to want to come in as a collaborator. They may be willing to draw communications from you at the point where they do have some level of interest, but they may even be alienated by a push communication, right? So this is one way of thinking about stakeholder engagement and which method to use. Again, this does not get to what are the methods and what are their strengths and weaknesses and how do you pick the right method for your given context. And so that's where we're going to go next, I think on the next slide here. Oh, I apologize. There was one more slide, which I'm going to go very fast because I feel like for this audience, we don't need to sell you on why stakeholder engagement in the research process might be of value. But there have been multiple prior studies. This was a terrific webinar that PCORI put together a couple of years ago, where they talked at different levels of, the researchers, for the patients, for others. And I think there's 2 or 3 slides from that set of presentations that are on this one here about the benefits of stakeholder engaged research and who derives those benefits. And I'll just say, broadly speaking, there's pretty good evidence that the people who become engaged in the research benefit, the researchers benefit, and ultimately the world and the patients affected by the research in the world all can benefit from effective engagement of relevant stakeholders in the research process. So next slide, please. This is where I'm going to turn things over to Bethany.
All right, well, thank you so much, Matt. Every time I see you give that little talk, I learned something new. So thank you again for inviting us today. And so I'm going to be talking about how you actually go about selecting approaches, methods, and tools for stakeholder engagement in research or in general, in program implementation, perhaps. So Matt and I have been part of this group as a part of the Data Science to Patient Value Initiative at the University of Colorado. We also have resources contributed from a group called the Adult Child Consortium for Health Outcomes Research and Delivery Science, as well as our Colorado Clinical and Translational Sciences Institute. And over the last several years, we've been working as part of a fairly large team to develop this Stakeholder Engagement Navigator web tool. One of the things that we heard a lot from investigators at the University of Colorado was we totally are in with this concept of stakeholder engagement, but we don't know how to do this. please provide some guidance. And so we do a lot of consultation with investigators to help provide guidance on how to do stakeholder engagement. But we also wanted to develop this tool that would be more publicly available especially for beginners. But this is a tool that I personally use, and I've been doing this for a little while. So we're really excited to share with you the development and use of this tool. Which you can access at dicemethods.org. You should just be able to type dicemethods.org into your browser and access the tool. So the Stakeholder Engagement Navigator web tool is an interactive website that supports the process of stakeholder engagement in research by providing information about various methods for engaging different types of stakeholders in research from one component called the Engagement Education Hub. It also guides selection of engagement methods based on the specific purpose and the resources available via the engagement methods selection tool. And as I mentioned, it's designed for use by researchers as well as stakeholder partners at all levels of experience in stakeholder engagement and at any stage of a research project, from planning through implementation to dissemination. So as Matt mentioned, picking who your stakeholders are, figuring out how engaged they will be, how much time they'll be willing to commit to meeting with you, to have conversation, bidirectional, longitudinal relationship. And are you doing this at the beginning phases of your project in planning your research or your program? Is it in the actual conducting of that research or program implementation, all the way to disseminating findings and the products of your research? So just very briefly, we note that stakeholder engagement is increasingly expected by funders, and certainly that's the case with PCORI, but we're seeing it in other federal funders, including the National Institutes of Health. Certain types of studies, they're expecting stakeholder engagement, and certainly in more foundation-funded research and local community implementation as well. It's long been expected that we do at least community-based participatory work. However, we know that many researchers struggle to understand how to adhere to the principles of engagement and to select and use appropriate engagement methods. Often in research, we get really comfortable with a particular way of doing something, and we go for that same thing every time. How do we make sure that we're matching our methods to our particular purpose in our particular project? We also know that consultation services for engagement methods are pretty limited resources. And as much as we love doing consults, we also wanted to make that resource more broadly available. So our goal was to create this web-based tool to help researchers and stakeholder partners select and use methods of engagement. We used the design thinking process to develop this tool. And in approaching the design, we thought, well, what education and expert guidance do health researchers need to select and use engagement methods? What criteria for engagement methods in the research context are relevant to decisions about which method to use? And ultimately, what features of a web tool would help researchers and our stakeholder partners with self-directed selection and use of engagement methods? And what you see along the bottom here is a representation of the phases in design thinking, which is a way of conceptualizing human-centered design. So here is the homepage for the Stakeholder Engagement Navigator web tool. If you play this little video, it's me talking a little bit about stakeholder engagement principles and how to navigate the Navigator. And we're in the process of updating that video to incorporate a community partner as well. And you'll see across the top here, there's both our education hub and our interactive selection tool. And alongside the left-hand side, you'll see where it notes strategy fact sheets. And so this is an easy way to access all the different approaches, methods, and tools for stakeholder engagement that have been cataloged on this site. So if you click on the little arrow here, it expands and it shows you all the different options that are available. Is there a question? Okay. And so here's an expanded view of what you would find under the strategy fact sheets. So we think of approaches as being high-level frameworks for how to approach the process of engagement. The general principles that you might bring to bear in developing partnerships between stakeholder partners and investigators. You might have a community-based participatory research approach. You might have a community-engaged research approach, some slight distinctions there. You might have deliberative processes. You might have experience-based co-design types of processes. And then the DeVerka conceptual model and the PCORI D&I framework, dissemination and implementation framework, are also useful approaches as well. And then a method is a particular set of step-by-step activities that meet the definition of stakeholder engagement that Matt mapped out, including that bidirectionality and longitudinality component for building true partnership or authentic partnership. And so what you see listed here are those methods, those step-by-step approaches for how you actually go about engaging stakeholders bidirectionally and longitudinally. Also, as Matt mentioned, there are some types of techniques that you can apply in the context of a broader engagement method that are really useful. Many of these are group facilitation types of activities, or maybe some data gathering activities or decision-making or consensus-making type of activities. And so we recommend the tools as part of a broader initiative in stakeholder engagement. And our engagement method selection tool provides guidance on both methods and tools, whereas the approaches are sort of separate. Within our education hub, there's first the basics. So getting started with stakeholder engagement. What is engagement? Why do engagement? The evidence base for stakeholder engagement, and where is there an opportunity for doing more research? Understanding the core principles and how to identify stakeholders and establish their roles in your research. Then you can get into a deeper dive. So after reviewing those basics, you can get a better understanding of, well, what do we mean by a stakeholder engagement approach, method, and tool? How might you figure out what types of engagement approaches would be appropriate for your project, and then using the Stakeholder Engagement Navigator selection tool. And then there's a little bit of background around how we developed the website and our organizing framework if you are interested in our process. So when you select the engagement selection tool, there's a few things that we ask you to come prepared having thought about. Number one being, what's the purpose, or what do you hope to achieve through stakeholder engagement? As Matt mentioned, this is really primary, and when we engaged our stakeholders, that is health researchers seeking to do stakeholder engagement, that was what really rose to the top of, I want a method that fits my purpose, that is highly relevant to what it is that I'm trying to accomplish, that it's aligned with my phase of research and the types of activities that I'm going to be asking, and the tasks that I'm going to be asking my stakeholders to do. And then there's a whole bunch of logistical considerations. Number one is, do you have any money to do this? Can you pay your stakeholders? Do you have the right expertise on your team to pay the personnel that are needed to do often event coordination? A lot of these require getting a bunch of people together in the same place at the same time. And often these days we do that more virtually than we do in person, but all of those things take money and time. Also, as Matt mentioned, you might have certain stakeholders that are all in. They want to partner. They will be there with you at every step along the way. So how many interactions do you anticipate your stakeholders will be able to commit? You might have some stakeholders, often very busy decision maker types of people, who may give you 20 minutes. And so what can you accomplish by engaging those stakeholders for 20 minutes? And ideally, this would be more than once over time, but you'll take whatever you can get. And then, as I mentioned, what types of staffing and expertise are available to you. So our engagement page, the pages that we've developed describe kind of what you need to actually do those things from a staffing and expertise perspective. And so as you approach this web tool, you want to first indicate your research stage. Is it planning? Is it implementation or dissemination? And then why do you want to engage your stakeholders? And you can select multiple reasons why you might engage under each of these different research stages. And after you've done that, you've indicated your research stage and your purpose of engagement. Then you come to this tool where you'll see these three different little slider bars. One asking, do you have any money at all? Do you have a moderate amount or high amount of money? How much time do you anticipate your stakeholders will spend per interaction? And how many interactions do you anticipate they'll be able to commit? And what you'll see there, if you go to the website, is that the methods and tools that align with your research purpose and your logistics, they will get bigger and have a darker little circle around them. And so for this particular investigator who said, I'm in my planning phase. I want to know which topics are important to my stakeholders. I have kind of a moderate to large budget. I think my stakeholders will spend a decent amount of time with me multiple times. It's recommending appreciative inquiry, a Delphi technique, or human-centered design as the top recommended methods. And then these more royal blue ones, those are also potentially a good fit. You might want to explore those. And then they get smaller and lighter blue, the less recommended they are, but you could still consider them. So when you can click on these little boxes and it brings up a brief description of what the technique is, and then you can click more information and it brings you to these strategy fact sheets that walk you step by step how to actually do this technique. And all of these are downloadable as PDFs, so you can save them, you can print them and refer back to them over time. And I believe we'll have questions later, but I'm going to turn this over to Matt DeCamp to talk about evaluating engagement. Thank you.
Well, thanks a lot for having me here too. I apologize for being a few moments late. My name is Matt DeCamp. I'm actually a primary care doctor. I'm an ethicist as well. I have a PhD in philosophy, and I've had a longstanding interest in particular in engaging patients and families in healthcare at the organizational level. So that's just a little bit about my background, and it's sure a pleasure to be here and to talk about some of the work that Matt and Bethany and I have been doing. And I'm going to focus my time, the last 10 minutes or so here, to leave ample time for questions on what I think we see as a bit of the future of engagement, and that is its evaluation. So we'll go on to the next slide. So I'd like to start with a lesson or two from history. And, one is a personal lesson for me. It's been in my experience that rather being a universally deliberate process, sometimes engagement in research and engagement more broadly can be idiosyncratic, or almost accidental. It relies on the unique interest or expertise of particular individuals involved in a particular project. And I think just at the outset that we should demand the same kind of robust evidence base for engagement science as we do for science more broadly. I think that's a really important feature of engagement looking forward. I also think there's an important lesson when we see across the board different spectra of engagement. You may have seen that Matt Wynia showed a spectrum of engagement, and that in fact, many of these spectra link back to Sherry Arnstein's work in the 1960s and this ladder of citizen participation on the left. A lot of the concepts translate, but if you look closely at this, we'll click. You can notice here the classical work, Arnstein's work on citizen participation, considers consultation with stakeholders, a word and a concept we often use, as actually a form of tokenism. That is, if stakeholders' views are not actually incorporated, this notion of consultation can be tokenistic. I think that to me is a bit of a reminder, maybe shakes me a little bit to think, whoa, like we use consultation a lot, and yet in the original work around engagement, it's almost considered a form of tokenism. So I think an important reminder. We'll go to the next slide. Now, I happen to think, and others might agree, that engagement still has untapped potential. We might ask ourselves, well, why is it? What is needed to fulfill the potential of engagement to achieve the goals that we've heard and already talked about today? Well, I think that there are three things. The first, and you can go ahead and click all three on. And the three things that are needed are comparative evaluation of engagement methods. And I'm just going to spend a few moments talking about each one of these boxes, but I'm actually going to start with the third box here, and that's around engagement methods. And largely that's because Bethany has already spent a good amount of time talking about engagement methods. We sometimes knee-jerk, I think, in engagement to creating advisory panels, or having a patient co-investigator, or conducting qualitative research or surveys as part of engagement. But I think as the DICE tool that Bethany just showed you makes clear, we really need to recognize the vast landscape that surrounds engagement methods. I think of this like a toolbox. We need this full toolbox of different methods. And if we do, we'll click. I think that understanding this landscape can help us overcome some of these more vexing problems in engagement, the problems of tokenism, because we can use methods that elicit authentic input and create authentic partnerships. We can overcome issues of diversity and inclusivity by using and choosing methods that are accessible and culturally appropriate to all, and probably other problems we could think about overcoming too, if we spend a lot of time thinking about this toolbox and the different tools of engagement. But I'm going to focus on those other two boxes. So we'll go to the next slide and talk a little bit more about evaluation. There's this adage out there, if we can't measure it, then it doesn't exist. So evaluation often plays a central role in what we do and how we do it. And I think fortunately for us, there's been work over the past decade that has led to real progress in the evaluation of engagement efforts. So we'll go ahead and click. And here on the slide, I just show 3 or 4 or 5, you can click through a couple more, examples of ways to measure the effectiveness of engagement. There's the patient engagement in research scale with a citation. There's the research engagement survey tool that draws on community-based participatory research principles. There's PCORI's We Enact framework. There's the PCORNet framework that I know the Genetic Alliance is quite familiar with, and many others. In fact, so many others now of ways to evaluate engagement that there are entire websites dedicated to cataloging and comparing different ways of measuring engagement. So we'll go to the next slide. What does the future of this evaluation look like? Well, I think that now that we have evaluation tools, we have to be able to compare the relative merits of different tools. So on the screen here, I've shown 3 different examples of evaluation tools, one from PCORNet, one from the REST tool that's on the lower left, and one from the Pierce tool, that patient engagement and research scale, again, that I referenced on the prior slide. And just to give you a minute, you look at the items that are on these different evaluation tools, I think we could all agree that they're quite different. Just take a minute and look at them, look at the questions that are involved. So I think you'll see, like in the top left, we have some of these structural parts of engagement, the number of people involved, the number of stakeholders in governance, total number of participants reached, right? In the lower right, there are questions that evaluate the impact of an engagement activity on the participants themselves. Did they enjoy being part of the project? And in the lower left, the REST tool, sort of different questions. The focus is on problems important to the community. So asking individuals to assess whether a particular project or program has really been something that's of focus for a particular community. So I think very different flavors, different senses of evaluation here. And if you want to click, oh, we missed something on the prior slide, but it's not that big of a deal. If we think about these different types of, oh, thanks, Bethany. I know it's a little awkward to be moving the slides this way. I actually think that we're likely interested in some or all of these, right? I imagine if we went around the virtual room here and asked people what they gravitated toward, probably some of us are interested in structures. Some of us are interested in these different processes of engagement. And some of us may be interested more in outcomes. And we're probably interested in some or all of these, but the question, of course, becomes which ones. And now we'll go to the next slide. It may be tempting for us to think that there should be a universal set of engagement measures, but I think that we have to be wary of this one-size-fits-all approach, because the diversity of research projects suggests that we'll likely need to find this sort of goodness of fit between a particular project, those particular methods, and their evaluation. So unless we think, for example, that all research should be community-based research, and we might think that it should all be CBPR, we might imagine that engagement could look very different between a CBPR project to identify community needs and resources for COVID testing versus, say, a phase 3 randomized clinical trial of a new drug therapy. So I think we might agree that the way we conceptualize engagement and then the way we evaluate engagement could be very different between those two types of projects. We'll go to the next slide. This is the last box. Remember, I talked about engagement methods. That's where the DICE tool really comes in. I talked about evaluation, where we now have some tools and evaluation mechanisms, ways we can evaluate engagement. And the last box is comparative. So here I say that once we've agreed upon measures of engagement, and perhaps there are some core measures, some supplemental measures, and so on, in a sense of that toolbox, we can pursue what I might call, rather grandiosely, the holy grail of engagement in research, and that is, go ahead and click, comparative effectiveness research, so CER, on engagement methods themselves, to really develop that robust evidence base for engagement. We'll click, go ahead. So just to give you one example of a project like this, and I really give a shout out to Bethany, who's leading this project as part of a new U2C grant. It's a participant engagement in cancer genome sequencing network grant. OPTIMUM is this new U2C grant led by Elizabeth Klaus as the contact PI at Yale. And OPTIMUM includes an engagement optimization unit, again, led by multiple PI Bethany on the call. And so here, what we're going to do is simultaneously engage stakeholders around some of the key research issues in OPTIMUM, things like return of results and recruitment, and advance the science of engagement by conducting what we think of as one of the first CER studies of engagement, where we're going to compare a stakeholder advisory panel against social media-based engagement. So as part of this larger grant, we're going to use quantitative and qualitative methods to assess the differences in content, things like themes, recommendations, and priorities, the stakeholder engagement experience, things like stakeholder diversity, equity, feelings of respect, value, trust, and so on, and even cost. We're going to compare the relative costs of engaging stakeholders in these two different ways. So I think it's a really exciting opportunity. And again, hoping to build part of that evidence base, that robust evidence base around stakeholder engagement. So we'll click. I think that's our last slide. It looks like we have ample time for questions. So again, sure, thank the opportunity to be here. And I hope there are plenty of questions and room for discussion. Thank you.
Thanks very much, all three of you. Really terrific to hear your perspective and see the very cool things that you've put together. So the floor is open. You can either type your question in the chat or you can unmute yourself and ask. Catherine, I know you're being polite to see if others have questions first, but you can jump in if you want to.
I'll go ahead and jump in. Just a quick introduction. I'm Catherine Lambertson with Genetic Alliance. I work with our communities and our network in a number of ways, but one of the primary ways is our registry bootcamp course. So my questions are really reflecting the experience there. But so one of the things that comes up kind of working with our communities and bootcamp is around burden and engagement. How do you kind of balance the many benefits of stakeholder engagement with the concern around overburdening community members? There's already so much going on. Many people have full-time jobs as well as being caregivers or living with a condition, that kind of thing. So I'm wondering if you can just comment on that. What are some methods that you might suggest that would, kind of return value on engagement, but also limit some of that burden on community members? Thanks.
I can take that.
I was going to say, I'm waiting for Bethany to jump in on that.
It is such a good question. And it was one of the things that we considered in developing our web tool around this time required for engagement and the expectation for how many interactions, because you're absolutely right. These are often people with severe health conditions. We do in our OPTIMUM project, it's low-grade glioma. We've also done some work in high-grade glioma. And it can be very challenging in the midst of trying to care for yourself with a chronic health condition. And thankfully, brain tumors these days are becoming more of chronic conditions. And so we think about the social media based engagement as being one way that we can really limit that burden and gather input and build relationships and partnerships with people through systems and platforms that they're already engaging with. It's not a very hard sell to tell people, you know, come tweet at us because those who are already fairly well engaged with social media, that's something that they do anyway, and they're looking for information. So I think that the extent to which we can go to where the people are, engage in their context and in the context of their own lives without having to ask them to come to this extra meeting, that's ideal. But that's just based on experience. We don't actually have data on that per se. And as both Matts mentioned, the stakeholder advisory panel is a really common approach to engaging stakeholders a little bit more in depth. And it certainly does take a lot of commitment on the part of stakeholder partners to be part of those stakeholder panels, often for many years. I have stakeholder partners who work really closely with me and have been doing so for 8 years. And what ends up happening, I have found, is that those who are really into this, it kind of becomes their job. And then there may be a little bit less like, you know, the partners who are not quite as engaged, and you still need those other methods for making sure that the perspectives of those who are not part of this work for many years are well represented. And so I have a number of stakeholder partners that this is their job now, and we pay them a salary as to have them be involved in this way. Does that answer your question, Catherine?
Yeah, that's really helpful. Thank you. You know, it's good just to hear about more of those methods. And I think the point of meeting people where they are is so essential. It's one of the things we talk about with registries, you know, kind of building into your registry, actually collecting information about, yeah, what is it that matters to people? What should the research be focusing on? And just, you know, if they're already joining, just having that right there. So that makes a lot of sense. Thank you.
I might add to it just a little twist on what Bethany has said too, that we did a study 2 years ago of engaging patients and families, specifically in end of life and palliative care research, which really brings, I think, those issues of burdens to the forefront, and meeting people where they are and understanding that a stakeholder advisory panel that meets during the day, you know, may not be the best way to engage those particular patients and families, you know. And so thinking about that toolbox and how you can develop innovative ways of engaging, I think it's really important. But what I really wanted to get to is the bit of the twist, is that really understanding the burdens an engagement places and trying to minimize them can also help overcome those diversity and inclusivity issues that we sometimes see in engagement. Because by minimizing burdens and making it easier for more people to equitably participate, you can then get a more diverse more diversity in your engagement as well. So I think that this issue of burdens and inclusivity are somewhat connected.
Yeah, very good point. So we have a question in the chat. I'm in the middle of stakeholder mapping right now. My challenge is getting staff buy-in and understanding of its importance for the increased engagement. What's the best way to explain importance? And before you guys answer, I'm going to tell a fairly funny story from PCORI, one of the sort of culminating meetings of the first round, where we had a panel on engagement. It turned out that 2 of the clinical data research networks couldn't send their engagement folks. So one was a cardiologist, another one was a rheumatologist or something. They all spoke on how they certainly could talk about engagement, even though they weren't the engagement experts. And when it became my turn, I said, during lunch, I did a heart transplant surgery because, you know, I could just do that during lunch because I've heard you guys talk about it. So that was, and then I passed the mic to Joe Selby. But I think it's a great thing to talk about. How do we explain the usefulness of engagement? Because again, we look at budgets, et cetera. I think PCORI, when I left it a couple years ago, was about 8% of the entire budget was spent on engagement in the very institution that is supposed to be engaged. So go ahead, you guys.
I just, first, I love that anecdote. And I put in the chat the slide deck that they used for this PCORI webinar a couple of years ago, because I think it's a really nice slide deck, and there is a slide which maybe I'll just oh no, I can't do that, but there is a slide where they sort of summarized from the perspective of the researcher, what are the values, what is the value that is derived. And it's a nice sort of set of dot points. It's things that I think will not come as a surprise to anyone here, but issues like, you will be more likely to succeed in recruitment if you understand who you're trying to recruit, or you will be more likely to succeed in terms of your dissemination implementation plans if you know what the barriers are while you're designing them, rather than waiting and finding out afterwards that, that initial plan is never going to work. You're likely to be more innovative in your thinking if you bring people in to the design phase rather than waiting later, right? That you get stuff from people living with this illness that is going to be different than what you get from people who study the illness. And just harken back 1 second to one thing Bethany mentioned. One of the challenges, and this goes to Catherine's point as well about how do you get people into this process. If you only work with the people that are pretty easy to get in because they're really engaged, because they're really interested and they've been doing this for 6 years, they are not the same as they were 6 years ago. And there was a wonderful essay about this in Health Affairs a few years ago, a woman with type 1 diabetes who as a teenager became involved in research projects as a stakeholder engagement strategy, right? So she was one of the patients who was helping, and she wrote this essay, 8 or 9 years later, having been a stakeholder in multiple research projects. Now she has a PhD, literally a PhD, not just, a PhD in life. She actually got a PhD during this time frame in a related scientific field. And she says, what I bring as a stakeholder today is very different from what I brought as a stakeholder 6 or 7 years ago, when I was new to the diagnosis, when I was a young person. And so you need to be aware, a patient is not a patient is not a patient. And a stakeholder is, this is a broad statement I think we could say for almost anything. You bring one person in as a stakeholder, that's one person. They are not necessarily going to represent the experiences of everyone that they are supposed to represent. And that becomes increasingly hard for people to represent the sort of real world experiences of people who don't know much about an illness and are just grappling with it for the first time. If who you get on your stakeholder engagement panel is someone who's been dealing with this illness for 20 years and has spent an enormous amount of time with researchers, because this is the 4th stakeholder engagement panel they've been on, and they now know your vocabulary, right? They can talk to you just like everyone else, because they're in the mix now. They're not learning this. So that person brings a lot, but they are going to have a hard time saying, that word you just used, I don't think most people know that word. They may or may not remember that they didn't know that word 8 years ago. Anyways, I wish I could find the link, by the way. I loved the essay too, and I've looked for it in subsequent years, and I can't find it. So if anyone else finds it, I remember it was in Health Affairs, and it was, one of those essay, like a piece of my mind kind of things.
So Linda has a really good question, and I wanted to follow up a little bit more on what Jennifer was asking. We probably didn't emphasize quite enough in our talk today that the foundation of stakeholder and community engagement is about relationships. It's about getting to know people and being sincerely interested in their own lives and in their own jobs. And it's not about necessarily convincing them that they should get involved or they should be engaged. It's about starting with the message that you care about improving their job, improving their lives, and doing a lot of listening and developing that relationship. A lot of my stakeholder partners are my friends, and I know what they care about. I know what their struggles are, and I'm able to say, please come here because we would like to talk about how to address that particular problem. And so understanding the values and needs, resources, assets, and strengths of those that you seek to engage is a really important foundation so that you know them and you can communicate that what we're trying to do here is to overcome this problem and to make sure that the solution is going to be a fit to your context, your setting, your needs, and resources. And so it can take time to build that community and build that relationship, but it is much easier to get buy-in for something when there's that close connection from the very beginning. And then, let's see.
I see two really good questions. Maybe we'll do them backwards. The most recent one is around a very a stigmatized illness, and people who don't want to sort of make it known that they have this illness, and so they don't want to engage in the research process because the engagement strategies often involve bringing a bunch of people together. What do you guys think in terms of strategies from the methods that we've looked at that might allow for engagement in an anonymous or confidential way?
Love it. Linda's asking the next level ethics of engagement question, right? It's going beyond saying ethically we should do engagement and recognizing that even when we do engage, there are these other ethics issues that come up along the way that we have to manage. And I'll be eager to hear what Bethany thinks too. You wonder if virtual means where people could get on a Zoom and not reveal their actual name or photo and be able to, thinking about how to protect that privacy and confidentiality using some of those different methods while making it a comfortable place to share. I don't know, Bethany, what do you think?
Absolutely. So in addition to more of those virtual methods, so I do some stakeholder engagement with the transgender community, and they have a lot of concerns about privacy and safety. And so some of the things they've recommended is engaging through Reddit forums. They said this is a really common forum for people who are transgender because Reddit is very private. They're not your real names like they are maybe on Facebook and even to a certain extent on Twitter. It's fairly easy to figure out who people are individually. Another thing that I have found to be good for these more stigmatizing conditions is by partnering with a trusted community organization. If they already have trust with an advocacy organization or a community organization, and that community organization can vouch for you because you have a relationship with them, then people are often more willing to convene and provide their input.
And then Helena had asked earlier, one of the questions that I actually find to be very provocative and very important, which is how do you mediate the potential tension between scientists who, after all, may have 40 years of experience and a great deal of knowledge about how to conduct, whatever the research is. And then you've got someone with a different knowledge base, maybe also has 40 years of experience managing this illness, for example, but really does not know about how to conduct high quality scientific research and comes into this engagement process and says, I'm being disrespected because they didn't take my idea for a research project, but the scientist looks at the idea and says, yeah, that's just can't do that. Or we could do it, but it wouldn't give us what you think it would give, right? We can't get there from here. Or, there are barriers when you're dealing with people coming to a conversation with different knowledge base. And in the end, you are doing a research project, which needs to conform to standards of quality for research. So how have you moderated that tension?
Trust in relationships. If you can have just an honest conversation, I appreciate that input, or that's a really great idea. We'd love to do that. here's the logistical considerations. How can we try to accomplish that goal within the context of our resources or our constraints that we have available? And sometimes it gets contentious, like you can't do what we really need, and that's not good enough for us. And sometimes that is the case.
Great. Well, thanks so much. We are 1 minute over. I want to just quickly say thank you so much to the three of you. I'm so excited by what you're doing and the kind of cohesive and systematic way that you're going about this, and delighted when we intersect like this. We have a couple of tools I think I sent to Matt, and I will send again, that I think should be part of your collection because they were vetted by the 5 years and 90 organizations in PCORI. I'll also say to the rest of you, thank you for participating, for coming. Genetic Alliance has a Lessons from the Field webinar series, and so we want to hear from community members about how does this work? How did even if it's 20 minutes, 30-minute webinar, to kind of feed each other with the kinds of things that work. And then I'll also say Genetic Alliance also has a tool, I put it in the chat, community-driven innovation, we call it. We built it so that we could do essentially a Delphi process and better in a much shorter period of time using more modern UI, UX, and social comp kinds of technologies that allow real robust engagement. I have a saying that I often bring out, which is, I'm tired of being engaged, I want to get married. We advocates spend a lot of time participating in various studies and so on, and we really appreciate when folks like you really get it, and we're very happy to have had you with us today. Thanks very much to everyone.
Thank you very much. Appreciate the opportunity.
Thanks.
Thank you.
Bye-bye.